already starting. I think we'll just hop into things if you're good to go,
It sounds
Alexa.
great. I'm here.
Great. I know all of you know who Alexis is, obviously, but we're super grateful that you made the time to have this conversation in the middle of everything that's going on. Before we sort of dig into it, how are you doing? Is that a weird question to ask these days? Like, are you okay?
I'm grateful that I have so many amazing people in my life to do this work with. That I've a family that supports me, a team that is incredible, and that we do this work in service of the real people who are on the front lines fighting tyranny every single day. And so, I take just small pleasure and pride in the fact that like I can be okay because
Yeah.
of everyone around us. Yeah. And how are you? I every time I read abortion every day, and I think about the the lengths and the space that you have built to like go and help us understand this the state of play. That can it is incredibly dark as well.
Thank you. Yeah, it's hard, but honestly, and I'm sure you feel this way, where it's if you're doing something, it just makes you feel better. You're like,
Yeah.
I'm taking action, I'm doing something, I'm not just sitting and watching this happen to the people around me, to me. Like you're actually honing in on something, which makes a difference. But I'll be interested to see what you think about the piece we have going out later today or tomorrow. Um, I don't want to say too much, but it's another pregnancy loss related arrest. Uh,
Okay. Yeah.
which is so it's just like, of course there is. For obviously there's so much going on, uh, and you all are certainly in the thick of it. But for anyone who needs a refresher or who sort of knows that Planned Parenthood is under attack, but doesn't necessarily understand exactly what's going on, could you give sort of a quick explainer for folks who haven't necessarily been following super closely?
Yes, absolutely. And I'll start from like the most present, and I could work a little bit backwards if it's
Right.
helpful. So on July 4th, as we know, the president signed into law the this big bad betrayal of a bill that essentially defunds Medicaid, some Medicare, and some other things, some other horrible things. It's the largest transfer of wealth to the wealthy on the backs of healthcare. And inside of that defund, inside of the essentially defunding Medicaid for millions of low-income Americans, there is also a defund Planned Parenthood provision. It is not called that because Planned Parenthood is not a line item in the budget, but essentially it denies the ability of Planned Parenthood providers to get reimbursed from Medicaid insurance for other services, if because we provide abortion, and that is explicit. It is targeted. It is designed based on defunding Planned Parenthood, and that essentially went into effect immediately. Unlike the other Medicaid provision, which will go into effect after the midterms, this one went into effect immediately. We filed suit. Also immediately on Monday. And for the first time, Jessica, for the first time, we actually
Yeah.
got a same day temporary restraining order, which is like unheard of. And that to me tells me that like people do understand the public health impact of this. So that's like that's one. And we can stay there and I can go backwards even further if you want.
We can, I mean, listen, we can talk about it all. There's a lot. Why don't we talk about, you all, and I've been calling it the same thing, we've been calling it an informal national abortion ban, right? Because
Yeah.
this is not something that's just going to impact conservative states. This is
Right.
going to impact the entire country. And it's sort of this roundabout way that Republicans have found to ban abortion for those of us in pro-choice states as well. And I think you all put out some stats and some numbers showing that actually a large majority of the clinics that are in danger of closing are actually in pro-choice states. And sort of as a whole, and please correct me if I'm wrong,
Yeah.
that it's 1 in 4 abortion, that we stand to lose 1 in 4 abortion providers. So
Yeah.
could you talk a little bit about like that tangible impact, not just for red states, but for the whole country?
Yeah, absolutely, and I think it's really important to understand because it's also just kind of understanding what has been happening over the last decade or so since, or a couple decades since, Obamacare, right? Like where we are understanding the impact of, of states that have abortion bans, largely red states that did not expand access to Medicaid under the ACA. And so the real risk under this defund provision is that roughly 200 of our health centers, we have about 600 health centers total. So a third of them are at risk of closure because the majority of what they do in terms of their resourcing and supporting things like STI testing and birth control and access to treatment and cancer screenings and breast exams, like the whole litany of sexual and reproductive health care is under attack because it puts these health centers at risk. And 90% of those 200 health centers are in states that actually provide abortion access. So just like you, I mean, we've been saying this is a backdoor abortion ban. This is a targeted attempt to defund Planned Parenthood because we provide abortion, not because Medicaid pays for abortion, but because we provide, they've figured out a way to um, to target us and maybe loop in one other provider in a way that that allowed them to strategically get out of the bird rule,
Mm.
and that's essentially where we are.
Yeah. Do you think that voters largely understand what's happening? I mean, there's so much going on in the news, and there's sort of this, attention problem and just the headlines every day. Do you feel like when you're speaking to people, and I know you're traveling a lot, like, do you feel like it's sinking in with voters just how catastrophic this could be?
Yeah, this is a deeply unpopular bill. I mean, and you can see it because of how close it was, right? It essentially won by the exact margin in the House and the Senate that was needed to pass it by a vote.
Yeah.
In fact, right, JD Vance had to break the tie in the Senate, and the House just passed by its 4 vote margin. And so I think that tells you a lot, right? That the electeds do not want to take these votes, that they were hearing from their people that um, you know, the more people learned about this bill, the more the dissatisfaction went up. People are alarmed; they are upset, and as I've traveled, prior to this bill, and in the week after the Senate voted to when it right before it went back to Congress, the things that really was hearing is that, like, a lot of people don't understand that. Um, there are a lot of people that didn't actually realize that they were on Medicaid because of
Yes.
the ACA.
Yeah.
It's called Apple Care. It's Badger Care. It's
Yes.
whatever, Gator Care, whatever it is in your state, or the name of your exchange, or it's coming through the superintendent in your school, and or your ability to get hospice care for your mother-in-law. And so, like, there are all of these things that are just like critical life events
Mm.
that have been supported through a social safety net that this country has long stood for, over the last, almost century. And, and to see it just being gutted in this way is really, really phenomenal.
So what happens, because I think the temporary injunction that you all have, it's like a little over a week, right? Now I know it's 14 days, it's like a little over a week. Um, what's your hope there? Like, what's the expectation?
That it becomes, sorry,
No, it's
bless you.
okay.
Slightly. That it becomes a permanent injunction, right? We're
Yeah.
trying to go from a TRO. I'm sorry, just give me 1 second.
Yeah, take all the time you need, and honestly, I'm happy to chat.
Freestyle.
Chat too
Freestyle for
much.
2 seconds. Let me go over and call.
Go cough, go grab a glass of water. That is actually the big upside of these is that it's not like doing an MSNBC hit where you have to, like, just have it choke in your throat for 10 minutes straight. You can actually go and cough and take your water and do what you need.
Exactly. Okay, here I am. I'm back. Can you hear me again?
I can hear you.
Okay, great.
You're all good.
Okay,
Yeah, so
terrific.
just talking about the injunction. So it becomes a permanent injunction. Um, and then what? Like, what should people be watching out for as they're following, the case?
So we have 14 days in the first stretch, and then it could be renewed for another 14 days. And then we're
Okay.
able to make a case, right, to the court about the public health impact. And so using that to get a permanent injunction that then allows preliminary injunction that allows us to make the case that we are making that can go up further up the courts.
Right.
But it allows what it does is allows Planned Parenthoods to still stay in the program and see
Right.
patients through the program, get Medicaid reimbursement, and make those choices there.
Right. Right.
Yeah.
So I wanted to talk a minute about sort of how desperate Republicans are to get Planned
Mhm.
Parenthood to stop performing abortions, right? There is this sort of famous story that the late Cecile Richards wrote about in one of her books that during the first Trump administration, which feels like I hate even saying that, like the first Trump administration. But during the first Trump administration, she was approached by Ivanka Trump and Jared Kushner, who presented her with what was sort of like a bribe, right? Saying that if Planned Parenthood wants to keep their federal funding, they need to stop performing abortions. For them, it was sort of this, gross attempt at deal making. They thought it was going to get them all of these like great headlines, right? Really disgusting stuff. But obviously, they're obsessed with this. What would you say to anyone watching, anyone concerned that Planned Parenthood might give up on abortion for federal dollars to make sure that they can get those federal dollars?
What I would say is that's not going to happen, right? I'd be like, Planned Parenthood not providing abortions and cutting a deal with Donald Trump. Like, I don't know her. Like, that is not that is not who we are. And look, let me tell you, I was on the board. I was on Cecile's board when the
Oh,
board took the vote to ensure that Planned Parenthood was a core service that we provided, right? So essential to actually carrying the brand name for our affiliates. Like you had to have a health center providing abortion care, and that was a momentous moment for us as an organization to not separate out abortion from healthcare, from sexual reproductive healthcare. So all
yes.
of these efforts are about trying to destigmatize, separate abortion from healthcare, trying to cut deals that really are just false choices, right? Because at the end of the day, we believe that abortion is healthcare. It is part of the sexual and reproductive healthcare spectrum, and we are going to continue to provide it proudly. I might add. And I think particularly in this moment, right? We are 3 years past the Dobbs decision, where we have learned so much about the impact of abortion bans on pregnancy, on people having to travel, crazy lengths in order to get care. To your point, the criminalization of miscarriage and other pregnancy related challenges. And I feel like even more clearly that we can stand on the ground of being a proud abortion provider, and no deals are happening here.
Best sentence ever. No deals are happening here. And I'm really glad that you brought up this sort of attempt to separate abortion from healthcare. That was literally going to be my next question because I see this obsession with getting Planned Parenthood to stop providing abortions as part of this broader conservative strategy, right? To divorce abortion from healthcare. They don't want to admit that abortion is a normal part of healthcare. Uh, I've been as I've been doing the newsletter, I've seen them take this idea to court. I think in several states, they've brought it up to their state Supreme Court to say, no, this protection, this state constitutional protection that says you have the right to make your own healthcare decisions doesn't mean abortion because abortion is not healthcare, right? They've been trying to push this sort of cultural message that abortion isn't a medical intervention but an intention, right? It's only an abortion if you want to end the pregnancy, not if it's miscarriage treatment, not if it's right? So I'd say that like right behind fetal personhood, this is what I worry about the most, this attempt to sort of separate abortion from healthcare. And I'm wondering how successful you think they've been in codifying that idea into bills and policies or just pushing it culturally.
Yeah, and I think the most important thing that you just said there is the ways in which, if we choose, right, if abortion is elective, it is no longer healthcare, right? I mean,
Yes.
at the end of the day, it it reveals their true intention, which is really about power and control, right? And like our expression of self-determination, right? Making decisions, like the fullest expression of self-determination, of making choices
Mhm.
about our lives and our bodies and our futures, and that we control them, is what is animating all of these bans. So culturally, that is their end game, to police and shame our ability to make our own decisions 100%. And so the ways in which I think they've tried to do that, because they realize that the overreach is that they're, trying to find other ways to have conversations around miscarriage, or other ways to have conversations around IVF, or pregnancy, because it allows them to kind of stay on one side of reproductive health care and not actually include right, and distance themselves from abortion. And so I think the more, I think they have tried, I think, to your point, from a personhood perspective, from certainly, they don't talk about the elective abortion as much, but I do think that it is always present in the way in which they are designing these bills and these provisions. And I think what has come to pass, right, is people's fuller understanding of why we say abortion is healthcare, and why you cannot police, all of the ways in which, pregnancy related outcomes, right? That is why that these are decisions that have to remain in our hands, in our doctors' hands, in kind of relationship with the people that we want involved in the decisions. And I do think that is I think that's what's incredibly problematic here, even with this defund bill. I think of the defund bill as well, in the context of, there's an annual, so the way this language was written, it was written to be a 1-year provision. It was started out as a 10-year
Sure.
provision.
Mm.
And the 10-year provision cost the government a lot of money, because our patients, where would they go? The 1-year provision costs the government money, but obviously less because it's 1 year. But they will look at this as an opportunity to do an annual, to build this into annual probes, or to build this into, an annual strategy, in the same way that they have used, the racist Hyde Amendment
Mm.
to deny low-income women, largely women of color, access to using their Medicaid for abortion related expenses. And so I think their ideology, and their, quite frankly, racism and misogyny is being codified into
Yeah.
the law in ways that are showing that 100%.
Yeah. It is really seeing how, like, eager they are for the punishment piece, I think
Yes.
is so difficult to watch, but also, like you said, they reveal themselves. They really do reveal themselves, and while they don't always talk about, like, elective abortions, they do sometimes.
Yes.
As soon as you said that, I was reminded of, this bill. I have to check where it's at now, but this bill that Republicans were advancing in Nebraska that would mandate, that abortion patients, have to have their, fetuses, or, embryonic remains cremated or buried, elective abortions, right? Only elective abortions would the law apply to. So tell me how that has anything to do with, the dignity of fetuses, which is what they were saying, if it's
Yeah.
about elective abortion. Like, they really do just give up the game every once in a while in this just unbelievable, unbelievable way.
Yeah. They just want to shame women. They just want to ensure that, we are. I actually don't know what the end game is. I mean, I do know what the end game is, but then there is something, though, that is, for to be in a aligned with a party that is also so focused on deregulation of everything else except for our bodies, right? Deregulate guns, deregulate the climate, deregulate, big business, allow all of these other things that actually have more to do with our lives and our futures on this planet. And then when it comes to what I do, it's no, regulate it all. Yeah.
Yeah. Regulate it, track it, put it on a
Surveil it. Exactly.
surveil it, put it on a public dashboard. Like I'm sure you've been following like all of this stuff in Indiana and
Yes.
Ohio, where they want to like just completely change the way that abortion reporting happens. The fact that abortion reporting happens at all is bananas to me. Like you don't keep reports publicly available reports on how many appendectomies people get in a state, right? Like it doesn't make any sense other than that sort of shaming and fear tactics.
Yeah, it's to make us scared, right? Exactly, right?
Yeah.
To make us not actually, trust people around us to, destroy relationships between patients and providers. Like I think about healthcare, like the very currency of healthcare is trust. You have to be able
Mhm.
to, providers have to trust information coming from their patients. Patients have to be able to trust their providers to share. That is actually what leads to, great, diagnoses, prevention, and treatments and healthier communities. And these laws are really undermining those relationships, and then from a public health perspective, not allowing us to really understand what's operating. I say this like on a day when the measles is now a real thing in this country that was eradicated, decades ago. So yeah.
I know. It's insanity. Um, no, but I'm glad you brought up the breaking down of community trust, and it's one of those things that makes me so furious that they still have like co-opted this language of family and community and being pro-family, and you're incentivizing people turning each other in, you're incentivizing community breakdown, people not trusting each other, people not trusting their doctors. It's
Yeah.
I could go on forever about that.
Yeah.
But I wanted to ask, one of the first things that Trump did when he got into office was to pardon 24, violent anti-abortion extremists who had been convicted of violating the FACE Act, which is
Mm.
the federal law that protects reproductive healthcare clinics. Right after that, the Department of Justice said they weren't going to enforce the FACE Act. Republicans have been trying to repeal the FACE Act. Vance went to the March for Life and said, you never have to be worried about being arrested ever again. I mean, like, really just giving extremists the green light to harass, attack, do violence to providers and clinics. And we know what the consequences of rhetoric like that is. We've seen providers killed. Just a few weeks ago, of course, a lawmaker was assassinated, Melissa Hortman, by someone who was an anti-abortion activist who had espoused, extremist anti-abortion views. It's a really frightening time, obviously, for providers, for the folks in this movement. How is Planned Parenthood thinking about safety, both in sort of on a policy level, but also on a broader scale, um, and also if people wanted to do something to help, are there state and local level sort of policies that they could be pushing their lawmakers for, right? If the Trump administration is going to refuse to protect providers, with the FACE Act, what can we do?
Yeah. Yeah, it's a scary time. It's a very, very scary moment. And that certainly hit home in Minnesota when those uh two lawmakers were shot and their spouses, two of them passed away, and the horror and the fear that it sent through providers who choose every day to get up and they open up the doors of their clinics and walk through protesters and see their patients. In some ways that's not new for us, and
Yeah.
obviously we've had a history of navigating violence and extremism and death because of murder, because of some of these extremists. So it just is more than anything a reminder that the threat is ever present and clear and danger, and that's something that all of us in the abortion community are live with every day. I would say that for Planned Parenthood, knowing keeping our patients and staff is our highest priority, and even as the this administration chose to release those violent extremists, and also pardon the J6ers, like there was a connection between
Yeah.
many of the people who were hanging on the buildings, to protest a fair election, and those same people showing up at our clinics. So, I do think that it's important to remember that the the ideology doesn't stop at abortion access. There are other levers of power and control that they are trying to push forward. I would say on the local level, I think state governments should be trying to fill in that gap, right? Like, what is the Local FACE Act that is ensuring that they are tracking the folks who we know have been indicated that they intend harm, ensuring that they can do everything to support the clinics in the areas because and I think that's both from inside of the defund, ensuring that sexual and reproductive health care is included in their state budgets because that's a huge gap that's missing. And so I think the more that we can do to continue just to be able to provide the care is probably the most important thing that should be happening on the state level. And I think
Mhm.
from a safety level, those relationships, of with our law enforcement and ensuring that they know who those attackers are. Yeah.
Yeah. Do you think that state governments are gonna step up and fill that gap, if if need be, if the defunding
Yes, I
yeah.
do. I really do. They should be trying to fill those gaps. They understand the impact of. We saw it. That you don't need many case studies here. You've got Dobbs and you've got COVID just in the last 5 to 6 years of what happens when a health center is lost in a community, and when like patients essentially have three choices. They're either going to have to travel a long way across state to get, depending on how big your state is, to get access to care. They may delay that treatment, and if it's time sensitive, it could have a tremendous impact, or they may forego it altogether.
Mm,
We saw it in the Dobbs, right after the Dobbs decision, and also, which is kind of on the end of COVID, or tail end of I forgot, being in lockdown. What do we call it? Quarantined.
quarantine, yeah, yeah, yeah.
Yeah, I was like, what would we call? We saw it in huge increase in STIs
Mm,
in many
mhm.
states across the country. And something like chlamydia is highly correlated with ectopic pregnancies, right? And so,
Oh,
like, yeah, and so like there are
okay.
just lots of ways in which um not being able to meet your most basic urgent, sexual medical needs, can have a ripple effect into your, reproductive needs, right? And so I think
Right.
that's the other piece of it, right? Like, we're trying to parse out, treatment of, routine treatment of an STI, and not understanding how it relates to the need for pregnancy and the need for abortion, and
Mhm.
why those things need to stay together in a community,
Yeah,
among experts, so that people can draw those connections and help people understand those things.
yeah.
So, yeah.
Are you worried? I mean, something that I wrote about that Kylie has written about at Abortion Every Day is the worry that Republicans are sort of framing crisis pregnancy centers as a reasonable alternative to having Planned Parenthoods in communities, which is so like worm brained. I can't even begin to, like, these are not real clinics. They don't have real doctors. And yet somehow they're being incredibly overfunded. And we're sort of seeing like Republicans use all of this language. The term we sort of grabbed was comprehensive care. That was it. Comprehensive care. They're calling them comprehensive care clinics now, right? Not crisis pregnancy centers, not anti-abortion. They're comprehensive care clinics. Um, a lot of people are not going to know that these are not real clinics, that these are, fake anti-abortion, anti-birth control centers. How concerned are you guys about sort of the proliferation of CPCs and the way that they're just being massively, massively funded? I mean, they've always got a lot of, but since the end of Roe, just
Yeah.
insanely so.
It's alarming, and the way it often looks on the ground is that they rent the space right next to Planned Parenthood, right? And they use the same branding color, and it's like the same unnested peas. They do all of the things to try to make it seem like you were walking into a Planned Parenthood. They will even list on the outside of their building, like, come to us for STI testing and, birth control and conversations about, even if they are not providing that
Right.
care, so that, there's a
Right.
50-50 chance you walk into the wrong door because it looks so close to what a Planned Parenthood community has looked like. I've been in Ubers, going to visit a local health center, and I give the address, and the driver's like, do you know, are you sure you know which one you want to go to? Like, even the Uber drivers are like, are
Be
you sure?
careful.
And I say, I'm going to the Planned Parenthood. And he's like, okay, I got you, girl. Like there's also like this camaraderie of
Right.
people, who
Right.
are, like, I can imagine the way the WAZE ways for like CPCs to like help people. Like, is it still there? Yes, it's still there, and it's still harassing people, and it's still telling people that they can't make these decisions. Like, that to me is so incredibly alarming, and because they are being funded. I think the other thing that we have to pay attention to, right, is that where we these non-medical centers are being privileged as medical centers, and so they are also getting access to patient health information
Yes.
without having to, adhere to HIPAA, right? There's
Mhm.
no compliance to actually keeping your patient information private by these strangers who can then come find you. We have seen these CPCs function out of like mobile clinics, right? But really, they're
Yeah.
just buses that essentially kidnap people to
Yeah.
have these having a conversation and then not releasing you until you agree. Like, all of the ways in which even the most earnest person coming in to, figure out their options,
Yeah.
may come in with a trusting mindset, and then, their strategy is just to delay you, right? Until it makes it really hard to get access to care. And it's like, one last point on this is I remember talking to a patient in Louisiana a few years back who said that she had three different appointments with a at a crisis pregnancy center, and they kept delaying her, like, only to find out, like, at the end that she had, like, the person had no idea what they were talking about, that she kind of, like, finally uncovered it, pushed her to later in pregnancy, which meant that she had to leave Louisiana. And, I was talking to her, and I said, like, how do you feel? Like, and she was like, I feel manipulated. I feel violated. I feel
Yeah.
angry, right? I mean, outraged that someone could play, gamble with my life.
Yeah.
And yeah, and so yeah, that's
No, it is. That's. I mean, that's exactly what they're doing, right? Like they're manipulating and they're endangering people's lives. Last night in the newsletter, Kylie wrote about. She cited this NBC News piece where crisis pregnancy centers are being told by this sort of umbrella organization that does trainings and
yeah.
provides resources to steer clear of ultrasounds. They're very afraid of ectopic pregnancies, right? So if they think there's an ectopic pregnancy, to steer clear of giving that person an ultrasound because they're afraid of legal liability. There was a case in Massachusetts where, because they're not doctors, they didn't tell a woman that she had an ectopic pregnancy. She ended up having a life-threatening emergency, lost her fallopian tube. Um, but apparently, it's not just ectopics. They're starting to advise CPCs, don't give ultrasounds if you think it's an ectopic or a miscarriage because they might go get an abortion. You don't want to give an ultrasound to anyone whose pregnancy might necessitate an abortion. I mean, just
Which is just criminal,
exactly.
right? That you're like under like it, like how that is not considered. I mean, in every sense of it is fraud, right?
Yeah,
When you are coming in seeking medical advice, you're purporting to give medical advice, and enough to not give the ultrasound because you are worried
exactly.
about that liability is fraudulent and
Exactly.
incredibly scary.
Exactly. And it's actually this is a good transition. I wanted to talk a little bit about language because that trickery is sort of and that manipulation is so central to everything that they're doing right now. And on the legal and the policy side, Republicans know obviously that abortion bans are incredibly, incredibly unpopular. And one of the things that's been so fascinating to me over the last 3 years of covering this is watching the way that they have changed language, right? And watching the way that they're manipulating language and pushing disinformation, whether it's abortion trafficking or the minimum national standard. It's not a ban, it's minimum national standards, or the post-birth abortion. Um, they just refuse to tell the truth. And at the same time they have that going on with the language, we're watching this rise of disinformation with trad wives and incels and the social media, insanity. And I'm wondering if you can talk a little bit about how that level of language manipulation, disinformation has impacted Planned Parenthood's work. How do you think about it? Has it changed the way that you all operate in the world?
Well, I definitely think what has changed for us even more so over the last few years has been really, really connecting more with our storytellers, right? There's no, the language choices that they are using are intended to manipulate, right? They are intended to position their extreme power grabs and control grabs as reasonable, as common sense, right? As like Europe is like this. Like, why wouldn't we do this, right? It is a way to position Planned Parenthood or anybody who seeks access to abortion as extreme or what have you, and then to try to stake out a more center moderate view that I think the storytelling helps cuts against, right? Because
Yeah.
the ways in which people are able, very they shouldn't have to relive their own experience. They should be able to keep their own privacy. But for those who've been incredibly generous to like help people make meaning of why we should not enact laws that cover pregnancy outcomes, like, and all of the different ranges of experiences that people have, I think has just been incredibly helpful. The misinformation of that we also see online, right? Like just the active disinformation, the bots, the things that people are either being told they have to say through state mandate or the things that they are reading because they can't discern online or however AI is aggregating it, I think becomes, incredibly, incredibly important. But I was thinking, I was going back to the ectopic
Yeah.
pregnancy conversation, and I'm like reminded of the story in Florida with Florida State Rep Kat Kamick,
Yes.
right,
Yes.
who blamed abortion advocates for not being able to get care for an ectopic pregnancy. Due to an abortion ban. And you're like, you supported the abortion ban. We said these are the kinds of things that are going to happen. You voted for it. And at the same time, when you needed one,
Yep.
in your, in your state, not under, like that's the misinformation that also
Yeah.
impacts providers and hospitals and administrators, who are also being forced to live in this mis and disinformation. And so, yeah, I think we fight back with telling the actual stories. We fight back with the actual truth, and like we can always stand on that.
Yeah. It's been really disgusting to watch that level of disinformation about pro-choicers are putting women in danger by scaring doctors out of providing care, by by spreading misinformation, by spreading. It's so absurd and so distressing because they've been doing that from the beginning. Like it's been so fascinating in the worst way to watch them sort of preemptively seed that messaging 3 years ago. Like they were trying all sorts of different they're like, let's see what's going to work when women start dying.
Yeah.
Let's see what's going to work. Let's see what message is going to take hold. And this was the one, blaming pro-choicers. I mean, it's just one of the most
Right. Never mind the
cynical.
letters the letters criminalizing the providers that they sent, right? Never mind
Right.
the putting the fear of God of people traveling across state lines, right? Or parents, trying to secure access for their minors. Like, never mind the ways in which they have actually put the surveillance system in place. Like,
Right.
okay, right?
It's just it's insanity. It's insanity. Sticking with disinformation for a minute, I wanted to talk about birth control because there is so much really troubling disinformation about birth control online, and part of it is connected to this trad wife thing. And we're seeing a lot of conservative dollars go into sort of these conservative wellness influencers who spread a lot of mis and disinformation about hormonal contraception specifically, and rely on sort of feminist talking points, right? Like they tap into that really credible and real experience and fear that women have had with the medical establishment, feeling not listened to, feeling like their symptoms have been ignored, and they tap into that and spread all this misinformation. But it's not organic. It's not coming from people themselves. This is a concerted
Yeah.
effort to, to disparage one of the most important inventions for women of all time. Um, how are you? We know that they're coming after birth control, that they're
Yeah.
well into that.
100%.
You know, how are you thinking about that? What can we be doing when we're so overloaded with just the attacks on abortion, right? Like, how do we look forward to what they're doing next?
Well, I mean, look, I think they've made it clear they're not just it's never been just about abortion, right? It is about birth control. It is about IVF. It is about just like full and unfettered access to sexual and reproductive freedom, like writ large. I think that with bill, this defund bill, the alarm, it is certainly obviously of concern that it is as we stated earlier, is a backdoor abortion ban. But what also happens, right, is it puts at risk access to contraceptive care.
Yeah,
And even Guttmacher's, put out research that the FQHCs, the federally qualified health centers, um, are not able to absorb Planned Parenthood patients, right? The capacity to see the additional patients that Planned Parenthood offers in community, and the impact of what that could mean in not being able to get access to care, I think is pretty significant. So, you know, from a Planned Parenthood perspective, like we have, obviously we've invested a lot in our own telehealth and in PP Direct, which is our kind of online app, our kind of ways in which we can try to meet more need based on how people are evolving to get access to healthcare. And we also know that, that the majority of Americans have not made a shift, right, to
yeah,
getting access to care via a phone call or via their phone, right? And so, which is why it has been so important to ensure that we preserve an infrastructure in states, so that people are able to, go in and see and talk to a trusted provider. I think like that just remains the challenge here, right? That
yeah.
there is a very different experience walking into a Department of Health, clinic that may be only open on, you know, 2 days at the most inconvenient times for you to get off work and go. And, and you'd have to stand in line and, fork over more of your public information in order to get access to basic contraceptive care even. And I do think like in seeing these direct attacks on abortion, really fully appreciating the fact that it is undermining actually access to contraceptive care and all other ways in which people try to get access to basic health care.
Yeah. I want to ask you a little bit more about telehealth, but first I just want to remind folks that if you have a question, you can start putting them in comments. And Alexis and I will talk for a couple more minutes, and then we'll take a few questions before we let her go, continue saving the world. um, with, with telehealth, we know that. Um, Republicans are just like desperate to go after telehealth, desperate to go after abortion pills. They know that abortion pills and providers in shield states sending pills to patients in anti-abortion states have been one of the reasons that the abortion rate has not gone down. They're really pissed off about it. They really want to do something about it. We're seeing all sorts of attacks, legal and otherwise. Is there anything that you think we should be paying attention to that maybe people aren't? Is there anything that you really want people to know about telehealth abortion medication? I try to remind people to get advanced provision abortion medication as much as possible to have it on hand. But if there's anything that you think that people should know about telehealth and abortion pills, I would love to hear it.
I think what you just said is critically important, that there are multiple ways to approach policy change, and like the opposition, we've been thinking about long-term strategies to get back into the Constitution, all of the ways as you've seen the fight back state by state to secure legal durable protections in state. You know, I think they are hopping mad about this because they recognize that that behavior hasn't changed. It hasn't, because people always need access to abortion, and when they need it, they were going to find ways to get it, right? And that it is rendering their policies meaningless, right, in state. And so I think they while they are trying to fight for control over our lives and futures, they are, pissed about the fact that their power is being undermined. And so I do think that behavior behavior shifts are going to be really important for um, continuing to support the ground for the policy shifts, right? Sometimes behavior change is actually the precondition for policy change. It is about building power. It is about electing the right people, but sometimes the behavior, going above and beyond what policy can't fill or rendering that policy ineffective is also a pathway. And so I do think we need to be thinking more about what it means to see the behavior shift and why that is actually happening. And then I think we have to double down on these fights, on these protecting, the incredible providers who are providing under the shield laws in New York and Massachusetts and Connecticut and other states. It's a small handful of providers that are taking on these risks. They may never ever go to Texas again. Maybe they never wanted to go to Texas again. But at the end of the day, like, they are also making choices about um, the importance of the mission at the expense of their own kind of lives, right, and their families. And I do think it's a different kind of risk that they are taking, because because they obviously you don't come into the provision of abortion, as on a lark, right? Like, it's obviously very, very intentional and thoughtful, but they are taking on additional risk. And so I think supporting them, supporting the lawmakers, um, you know, I do think that advanced provision is really important in terms of, having people understand, what their options are. I say this is like a mom of a child is about to go off to college pretty soon. And, these are the conversations we have with our, fellow moms. Like, how are you empowering your child if they decide to go to a school that is in a state, right, that has
Absolutely.
access, right? Or, friend who may have to take a job someplace else. Like, how are they going to get supported? And I do think that those formal and informal networks are going to be really important, not just for the provision of care, but also for the movement work that needs to happen.
Yeah, absolutely. Carol has a comment. She says, "How about a shout out to clinic escorts, the brave and courageous volunteers who put their safety on the line for patients?" Absolutely huge shout out to clinic escorts. I mean, we were just talking earlier, Carol, hopefully you were there, about what's happening with the Trump administration just giving the green light to violent extremists, and clinic escorts are obviously quite literally the shield um, for folks. So
That's
lots
right.
of love to them, to providers, to volunteers, literally.
Yes.
Just incredible. Barbara would like to know, Alexis, how concerned are you that the FDA will add new restrictions on mifepristone?
I'm both concerned because we know that is obviously, right smack dab in the middle of Project 2025, and we know they're finding all kinds of ways to the point, attack Planned Parenthood, attack Medicaid, attack mifepristone, attack access, whatever angle they're coming for. We know that that's real. And then I also look at the FDA and I say, you've gutted the scientists, you've gutted um, you know, uh, the secretary is just kind of operating in some other world, right? That I'm not sure how effective, right, they will be able to come up with with rationale. I don't know that they necessarily need it, right? Which is, I think, the
Right.
point. But there is a lot of chaos that is also operating at the FDA that gives me some alarm and concern there, just broadly for all of our health
Yeah,
and lives. But I think they will try to find a way with junk science as they have to try to undermine it. I'm sure that will be one of the strategies.
yeah. Lauren would like to know, do you see anything more we can do to lobby Congress or just focus on the state level at this point?
I think there's two things. I think, over this next year, this is about the state level. This is about ensuring that, that we can do everything to ensure that states are supporting patients where they can, and to let lawmakers know that you want, with all of these guts to Medicaid and these defund provisions, that you want to ensure that Planned Parenthood patients are continue to be supported. And I think that working with your local affiliate to figure out the best points of intervention as states go into their legislative sessions, since those vary state by state. I think the longer game over this next year is about making sure that every single one of these um, lawmakers who have taken these votes to defund Planned Parenthood eats these votes for breakfast, lunch, and dinner, right? Like wherever you see them, whatever town hall they are in, whether they're on the plane, grocery store, at the dry cleaner, reminding them that you are not going to forget. There is not going to be a day before 2026 that you are going to forget that they took these votes to harm all of these Americans, all of these patients, all of these people who depend on Medicaid insurance, and you're going to make them pay for those votes, right? That's what they're afraid of. That's what's going to happen, and we need to make sure that they know. That to me is the most powerful thing that we could be doing right now.
Absolutely. No, I love that. We have an interesting question from Keely, who asked, "I have health insurance through my employer and choose to go to my Planned Parenthood clinic for reproductive care, owing to the fact that the quality of care is better than other hospital systems provider. If many more insured clients like me chose Planned Parenthood for their care, would that help my clinic be more sustainable, slash stay open?"
Absolutely, yes. Yes, all Planned Parenthood health centers take private health insurance, and I think that's it, right? It's the quality of care. It is going to see a trusted expert around sexual and reproductive health care. Many health centers, some provide the primary care as well, and so I do think that it's both a mission and an opportunity to get excellent, non-judgmental care wherever you go. So I think that is really amazing that you continue to do. And I know a lot of folks who, even after COVID, went back, like when our health systems were under strain, they went back to their local Planned Parenthood, because they felt like they trusted the protocols and they trusted the people.
Yeah. Molly would like to know how concerned you are about litigation ending up at this Supreme Court. And I'm curious about that too. I mean, I think we know, right, that sort of like the interstate battles, what's going on with Dr. Maggie Carpenter being, indicted in Louisiana, that is likely to end up in the Supreme Court. That's why they brought that case to begin with. Yeah, what are your concerns or thoughts?
I mean, I have the same concerns that all of you have about this court. Obviously, this is the court
Yeah.
that voted jobs. This is the court that gave the president, almost unlimited executive power. This is the court that sided with South Carolina in the Medina versus Planned Parenthood South Atlantic case, which also just came down, allowing state governments to decide, who Medicaid patients could see, and choose their provider for them. So I do think that this court has shown that they will, err on the side of power, and they will stay there. And I think we have to continue to remind them that we are powerful, and that and that we are also in it for the long game. Some of this is right. Recognizing that we're in a generational fight, right? There is the immediate need that we have to engage in on our, day to day, to ensure that we can see as many patients for as long as we can. And we also have to lay the groundwork for the restoration and reconstruction of our rights. And so I do think we have to keep an eye towards both, and that this may not be the court that restores our freedom. Almost certainly won't. But if we stay in the long game, we will get back there.
Yeah, no, that's what I keep telling myself every day. It's a marathon, not a sprint.
Yep.
It's gonna take a minute. That's okay.
Yeah. Yeah.
Um, Before we let you go, just a couple more questions. We lost Cecile Richards not too long ago, and I know that was really deeply felt by everyone in the movement and even outside of the movement. And I'm wondering if you can share any memories that you have of her, any advice that she gave you that is helping right now. Just any thoughts that you have.
Oh my gosh, yeah. We lost Cecile on January 20th, which was Inauguration Day, and it was Martin Luther King's birthday, or what we celebrated as his birthday this year, as a federal holiday. And you know, it is it's incredibly it was already a disorienting day, but to lose her on that day, on both of those days, I guess, and the way I have it in my head is it was it felt like she was leaving us a message, right? It felt like she was leaving us a charge, really, to remember that as we just said, that the arc is long, but it bends towards justice. A reminder that we have to stand in protest, and that as we watch ourselves descend into autocracy, part of the strategy of autocrats is to undermine protests. It's to undermine dissent. It's to create fear and chaos, right? So that we don't fight back. And I think the things that I learned from her for 2 decades has just been to just to stand firm in the face of the fear, to always remember the who is the why, right? Like centering the patients at the core of this work, and just being proud of what we do, like,
Yeah.
I'm not somebody who gets on a plane and they say, "What do you do?" And I say, "Oh, I work in healthcare," or "Oh,
Yeah.
I work for a political organization in DC." I'm like, "I work for Planned Parenthood. What do you have to say about it?" Right? And I just feel like, I'm channeling her of like never cowering back from, not even having, a moment when you were not evangelizing around why
Absolutely.
work is so important.
I love that. Just one last thing. I think everyone is probably going to feel very motivated by what you just said, but also I think the thing I hear most from people on this issue, on every issue, is that they want to do something, they want to help, right? Um, but they also feel sort of frozen with overwhelm with how much is happening, and they don't know where to start. And so I'm just wondering if you could leave us with some words of advice about, if someone is interested in helping and doing something and getting involved, what's the best way for them to do that, to sort of get out of that feeling frozen?
Well, I think the most important work right now, to the extent that people can engage on the action side, like if you want to engage on the let's say political side, the action side, I think going to a I'm4pp.org, you can find out where to plug in your local community, what actions are happening, because it is the reason we have gotten as close as we have, the reason we have been able to, win ballot measure after ballot measure, is because people have just shown up, right? And for as long as we have the semblance of democracy that we have, showing up is actually everything, right? Making those calls, patching them in, reminding people why, like that is a huge part of our civic work right now. And to not let this be on a back burner because it may not be the topic of the day, or you may have to fight to cut through the noise. So I think thinking about that, being really focused on the targets that we have next year, is going to be critically important. On the care side, I think supporting your local Planned Parenthoods is really valuable right now. These defund measures are intended to, move access away from communities and destabilize communities. That's what the entire Medicaid play is about, to destabilize communities and transfer wealth. And so I do think continuing to support and showing up however you can for them, I think, is really important. And it's, I find a lot of hope in spaces. There's one, I'll leave you with this, that I was on a clinic visit not too long ago, and inside the room where patients recover from abortion procedures and, just waiting for sedation to wear off. There is some centers have journals, and in those journals, patients write a note to a future patient. And the stories are, just everything they want to hear and read in the moment, and reminding people like, you are making the right decision for your life. You are a beautiful person. I see you, really hopeful for your future. I'm so glad that you were able to get such good, excellent care. And I think about that, paying that forward constantly, of that reminder of that, healthcare is politicized in this country without question, but at the core of it is our humanity, right? And the politics of it is deciding, right, who gets to be considered, who gets access to being seen and who doesn't. And I think that's what our political fights are about right now, whether or not we actually get to be, seen and valued for our own beings. And I think that's really important to remember right now.
Yeah. Thank you for that. I love that. Alexis, thank you. Thank you for doing this in the middle of such like an incredibly difficult and busy time. Thank you for the work that you all are doing at Planned Parenthood. I know I speak for everyone in the comments and anyone who's watching that we're just so incredibly grateful for everything that you all are doing, and that we support you. And that this community here is certainly, fully behind you, and we'll do whatever we can to support and make sure you guys keep fighting and providing the excellent care that you do. So thank you.
Oh, thank you, Jessica. You're such a critical part of the community and keeping us all understanding kind of what's at stake, and doing the deep research. So, I'm always up for a conversation with you and
Good,
this community. Thanks.
good. Then we'll do it again. Thank you everyone for joining. I'm going to send out the full video later, and I'll put that link that Alexis mentioned so you can find out where you can take action if you'd like to. And I hope everyone has a good night. And Alexis, that you can go and get some rest, hopefully.
I will. Thank you, you too. Take
Good
care.
night, everyone.
Bye.